Late in the year 2019, much of the world received a life-changing piece of news. Somewhere in the world, a deadly respiratory virus had mutated into existence and moved around so much due to its novel nature and transmissibility that it qualified as a pandemic. Thus, COVID-19 was born. The World Health Organization sounded the alarm and announced that lives were to be put on hold until the virus could be controlled, or at the very least, understood. Many workplaces were temporarily shut down. Some, such as grocery stores, medical clinics, and food establishments, remained open, but under a new set of circumstances. Masks had to be worn in all public areas. Dining in, browsing, and shopping were no longer options. Leaving the house was to be done for essential purposes only. Uncertainty loomed along with the vapor of a terrifying new virus, and across Canada, families wondered if their lives were ever going to be the same. 1 year on, and the COVID-19 pandemic has exposed glaring vulnerabilities in society, especially when it comes to workers' rights. 3 million Canadians lost their jobs between February and May 2020. 2.5 million suffered reduced working hours. All job losses were among people with lower than average wages. COVID-19 brought forward and exacerbated labor discrepancies that fell along gendered, racial, and abled lines. Racial minorities have had higher levels of financial stress during the pandemic due to working low-wage jobs who also do not have the option to work remotely. While big box stores were allowed to remain open, 160,000 small businesses across Canada are estimated to close due to COVID-19 permanently. Rarely has the need for labor activism ever been stronger in Canada.
Being forced to go through these cycles of lockdowns and such. Like, Paige and I haven't really worked for several months. Like, we haven't gone to work once in the entire 2021. I think the last time we went in was probably sometime in November, and we haven't really heard anything about there's no advance notice for us. Like, we find out the exact same time as everybody else finds out.
It has drastically changed it, like to a point where it's unbelievable. As a waitress, the main part of your job is connecting with the customers. But because of COVID-19, unfortunately, especially at the restaurant I work at, our clientele is mainly the elderly, and many of them have stayed away, which is understandable for health reasons.
But especially with everything that's going on, and the morale just plummeted to new lows. So many people were just like worried about job security. There was like constant fear of like a new policy that was going to affect our income, or if I was going to get laid off, that was also a constant fear, because in even Alberta, they closed off everything but the grocery and pharmacy sections of the store. So everybody else was basically out of a job. So I live on my own. I pay for rent. So it's a very stressful time throughout my duration of the job.
I got automatically laid off when the restaurant had to close because they couldn't make profits as needed, because not enough resident students around, and Uber pickup is still limited number. So surprising thing for me was that we had average of 3 orders every day, which is crazy.
Like the first couple weeks in, like as teachers not knowing what's next, like the principal would email us and say, I don't know what to do. I cannot answer your question. I have no clue. I am waiting. And like, to hear that from the person in charge, and then you're going to work, you're like, we have no clue what we're doing and it was like nerve-wracking. And as teachers, we're all under stress, and
So some of them stayed back, but also there was limited capacity. It wasn't a case where all of them got the opportunity. No. Let me tell you how difficult it was. There was a case where a few workers told me they were at the airport. They did their COVID test. They were at the airport waiting for the flight. The flight was at 5 in the afternoon, and they got the results at 9 p.m. What does that say about the process, right? Would you say everybody got the chance? So that, in a nutshell, that is just one example of how complicated that was.
Maybe 2 weeks ago, I called. I got a message from one of our members. Said, "Hey, if you can reach out to this woman, you should give her a call." I was like, "All right." I put her on my call list, and I gave her a call. And she works in the community. She's a developmental support worker. So she works with people with disabilities in the community. And so I spoke with this woman, and she had, as soon as she knew who I was, she started to cry. She started to tell me that she's at home isolated by herself. She doesn't know if she's going to be able to go back to work because her husband had contracted COVID. So he was in the hospital. Her son had contracted COVID. He was in the hospital, and she couldn't see either one of them because of the restrictions. So I was on the phone with her for about an hour, and there was a lot of emotions involved. I was just there to sort of listen and encourage her. Less than a week goes by. I still had her on my call list. I was like, I'm going to check in with you, and we'll see how we can help you resituate yourself back at work and talk to your employer and all of that stuff. And so less than a week goes by. I get an email. Her husband died, and she couldn't see him. Called her up, and you can imagine how emotional that moment was. Just hearing how much she was hoping that he was going to get better. She was hoping that he was going to come home and things were going to get back to normal. All the while, her son is still in the hospital. And so it's those type of stories that are out there that people don't hear about, people don't know about. And so, because I just feel like there's so much going on, and there's so much that needs to be told, and the story needs to be one that really speaks to the experience of what's happening on the front line from an emotional perspective and a mental perspective, because there's some damage that's being caused right now.
So finding space to run the program, to store goods, a lot of community centers or places like that would offer space are just not open. So that's a no for us. The major challenge is just the growing need. As I said, we're currently servicing 1,000 people a week, and that number is growing. People's reliance, the reliance on food banks has risen 51% since the beginning of the COVID. So folks who traditionally wouldn't rely on food services are needing to turn to that just because if they are employed at the moment, it's not enough.
Challenges to the workplace is it was very much prided on face-to-face interaction. Again, a very social environment. Connectivity and communication amongst the teams was a huge method of positivity. The biggest challenge, I think, is trying to adapt so quickly to all of these changes. I really do believe that my company did the very best that they could in a very challenging time. However, there will always be things that are unplanned for, or things that are encountered that you didn't really anticipate or didn't know how it was going to work. I knew that they were working on work from home kits for a while, but not to the mass productivity, like to the mass production that we did once COVID started. It was meant to be on a much smaller scale and not as big as it was. So definitely always challenges come up throughout anything that you may do. But I think in terms of even onboarding a new team, anywhere, it proves to be difficult depending on the method of how you onboard. Trying to figure out how to convert what you can do face-to-face to an online platform has its ups and downs, but it's definitely a learning curve, but not something that we can't all learn from to improve on and do better. Use that physical connection of camaraderie and that team environment that we're so accustomed to, that boosts the morale, that motivates the team. So it's trying to recreate that in a virtual setting, I think for me is just, it's definitely challenging.
Get ready, but of course there are more precautions that you take every day, wearing a mask and being more distant from people, and the general atmosphere at work is sort of different now. I mean, the closeness that there once was between people and departments, and it's just not there. It's harder to kind of build relationships and ask for help when you need it from other departments.
How these things worked in previous years, nonetheless in a pandemic, like if there's going to be any differences. And it's kind of just like at every turn, like there could be something new. Like we don't know, like tomorrow we could get a text saying that we're going to be needed to come in for as soon as the weekend. So it's just like we have to stay on our toes.
Like handling it, because there's a lot of couple, I think 8 or 10 COVID cases at my store for employees. And I was in contact with somebody that tested positive, so I had to get tested. And it was like this whole anxiety surrounding it, because I was in contact with my family members, and then they were in contact with other people, right? So it's like, oh my gosh, like if I'm positive right now, like all these people I somehow got in contact with, have to go get tested as well. So I think that's been like the suckiest thing, I think, about working is you're constantly like, I could go in today and I could get COVID kind of thing,
And so I actually have 2 assignments due on Thursday. I haven't been able to start because I have been working 10-hour shifts this entire week. And it's when I get home, I'm so tired and so drained that I just want to sleep. I would eat my dinner and then I go to bed. And it's definitely making it a lot more difficult. Like I had to skip my classes yesterday.
Pretty much so. There's a lot of policy changes throughout the store. So, more cleaning responsibilities, of course. Just more, just overall responsibility with, maintaining 6 feet distances, which is honestly fairly difficult, especially within the sales department. It's just having to always worry about, am I staying 6 feet away? Am I too close? Am I too far?
And just waiting for the government to say there's no going back to school this year did build a lot of anxiety, and then like planning and everything else around that in my life, like what I can do, and we're already locked down really, so there wasn't much. But it really put increased the anxiety with the unknown.
It's definitely, you definitely have less time to de-stress. And when I say de-stress, because like as a worker, like sometimes after you work a hard day, sometimes you probably would just want to, like on a Friday night, go to a movie. You can't obviously go to a movie now. Sometimes on a night you might just want to go out for dinner. You can't obviously go out for dinner. And these are the things that, as workers that used to recenter my morning shift. It starts at 7. So I get up at 5, get ready, all that stuff. And I take the 5:30 bus. So right away I'm putting on my mask. The 5:30 bus on Kiel, it's packed. Super, super, super hard to social distance on that bus. And for me, as I look around, I'm seeing other, minority, I'm seeing other people of color who probably are going to their essential job as well. And here we are, not being able to take a day off or not being able to work from home. And we're all just packed on there trying to stay safe as we can. Nobody knows, right? And then you get to the subway and it's the same thing.
So I think when you're looking at this type of work, yes, it's community-based, yes, it's donation-based, but it is absolutely viewed through a justice lens because the two are not separate, or the funding for housing. So all of these things are interconnected, whether it's food insecurity, senior care, senior hunger, lack of affordable housing, which is a huge driver of what we're seeing now. And whether it's government assistance in CERB or my brain just froze, in financial assistance of any kind. And so even with our work, yes, it's actual delivering of meals and addressing the basic needs of food insecurity and lack of housing. It's that secondary advocacy piece that we're always engaged in. Certainly from MP Pickers Glover, we formed a homeless advocacy coalition that is working to put pressure on the provincial government to include issues around housing, homelessness and housing, mental health and addiction supports, which is another social driver for a lot of folks experiencing homelessness.
One thing was that we had a big family come in at one point that I was seating, and I explained to them before they came in that since they had more than 6 people, I was going to have to separate them, but that I could do my best to get them tables as close together as possible. But again, when it is busy, it is difficult. So after I sat them and explained it all to them and left, part of this family went into a closed off booth that has a sign that says it's closed off because we have to have every closed for social distancing, and sat there and started eating there. And they had the kids running all over the restaurant, touching everything. And they wouldn't move from the closed booth when asked to multiple times. Like I had people, the family trying to say that the kids shouldn't count and it should be 6 adults. You're going to need to separate, and it's also for their safety as well. And a lot of people complain about that they are in the same household and that they should be able to sit together, which I do understand the logic behind that. But since the guidelines are 6 people per table, it's not like, there's no exception for people in the same household, especially because people can easily lie. So that was difficult to just be ignored half the time when I'm trying to explain things to them. They just still went and did what they wanted anyway. Yeah.
Not even like just in the pandemic. And I feel like this kind of goes with like sexism in the workplace too. Just being a woman in the food industry, a lot of people won't take you seriously. They'll think that you're just making a suggestion or something like that regarding to seating or like safety, but it's not. Like everything that we have to say is what the government is telling us to say to you. And a lot of the time, just because not only we're not like the managers or the servers, we're, I guess, seen as the low.
Oh, but really quick also, like we used to have 4 runners on staff, but 2 of them, they've kind of like dropped, and like I make the schedule, but when I make the schedule, it has to be approved by my boss, so like the owner of the restaurant. So they could really make it whatever they do. I just kind of show them like a blueprint and they accept it. But I found that when I would try to put those other 2 girls, they would come back with me that like, oh, you need to keep it those like the only 2 girls in high school because of COVID reasons. But those 2 girls in high school, they would be working every day, at least one of them, or both of them at the same time because of how busy it was. But they have high school and they were so drained and like they can't do it. You need these other 2 people. But he wouldn't listen to me.
A really important thing that it's brought to light is also like racism in the labor market, and how really it's no coincidence that a lot of these workers who are in precarious jobs are workers who are Black, are women workers who have really faced like the disproportionate and the brunt impacts of it. So like I think it's really allowed us to pinpoint with like a very clear example as to like what's happening in these spaces, which is like why we say at the Decent Work and Health Network that precarious work is a health hazard.
It's definitely more time consuming. It could be a bit more stressful as you have to navigate like, customers as you do this. And then again, there's the epic threat of, contracting COVID where now, it's sometimes people don't realize, like, even for me, like personally speaking, I'm wearing that mask for 9 hours, right? So some people have to put it on for a bit, and like for them, it's like, oh, it's so annoying. But like I'm wearing that mask literally for a 9-hour shift, so it's definitely hard to breathe in it. Sometimes it becomes difficult to breathe, and it definitely right. So and again, as I look around, it's all workers, it's all people of color who are jam packed trying to go to work because we don't have that job that's that offers us the luxury of staying home. So yeah, there's a lot
in order to set these precautions, in order to meet these these different needs of the world in a COVID world. The union had to get together with the producers and other groups to figure out what the best way to return to work was, and to set these standards. It's good to have people advocating for you and thinking of your interests without any connection to the work. You know, when you have a representative from a union, they're able to advocate for your needs specifically.
In the middle of January 2021, Ford basically mandated out. He sent out inspectors, health inspectors, to big box stores, and basically health inspectors were handing out tickets to employees. So basically, if they were breaking social distancing or not wearing their mask properly, or even at all. So us as employees, we were fined. If we were fined, we were going to be fined $800 around. If the manager or the supervisor were on site, they would be fined, I believe it was around $1,200. And the store manager, if also on site, was also fined, as well as the whole store as a whole. So everybody's really stressed out. So basically, with one of the new implementations they added, it didn't really last long, but regardless, is we were discouraged from bringing like our water bottles down with us. So because we would have to take off our masks, drink our water bottle, they didn't want health inspectors to see us without our mask. So we were basically barred from basically having any water bottle or liquid or anything next to us. So basically, especially in a very busy environment, so it's very hard to really like step away, especially the employee lounge is about 2 floors up from where I am. So you'd have to, take your 15-minute break just to have like a sip of water. So it was very like, people were in our sort of little revolting. It was just a very like stressful time. So much fear involved in it. I just see the whole fining. It was the fine for us was $800, and Ford was seeing us as essential workers and as heroes, right? I think that's one of the words he used. And he sees us as heroes, but yet he makes our lives that much more terrifying. And by implementing these hefty fines on employees, basically takes away essentially my full paycheck, right? For a 2-week period.
Because it goes beyond me. It goes to the other essential workers who are probably in a more precarious situation than I am. Like, I'm lucky enough that I have a union. Like, if, for example, something goes wrong, that the union could be like, hey, you guys got to pay him for this day. But there are a lot of workers out there who don't.
There's so many workers, like, being in a job that's like essentially low wage, you feel disposable, and our employers and other capitalists, they know that we're disposable. And so I feel like I'm forced to put up with this because at the end of the day, I'm grateful to have a job.
This goes back to confirm, what do we see in Canada? What do we see? Money, power, influence come into play. Money, power, influence come into play. And that is very clear, because what do we know? What did I discover in Canada? What are politicians loyal to? You, the voter, me, the worker, or you, the donor. And that is clear. The policies are clearly aimed at the donors. And what are the objective of the donors? Is profit, profit, profit before people. And that is what it is, right? So we face injustices at both in our living and working conditions.
I think in like the teaching realm, especially if there's a contract that was signed, there should be like compensation for a certain amount of time to find a new job. Because in my position, it was literally 2 days. It's like, oh, by the way, you don't have a job Monday. And some teachers found out Friday that they don't have a job on Monday. And it's like, we have to figure out, are we going to apply for EI or support? Like, there was nothing to kind of like support teachers at all. That was my experience.
Another story that's very striking is for early childhood educators, who are the educators who take care of like the little ones, and we know that these kids are always getting sick. And so by nature of that, the early childhood educators are also always getting sick, right? So they would use up because through their union, they are able to have access to some paid sick days. But the really important part about this story is that this early childhood educator, she had diabetes, and she had been recently diagnosed. So she was trying to figure out her treatment plan. But what happened was that she had already used up her allotted paid sick days, and she ended up in a condition where her blood sugar was so out of control that she got an injury to her foot, and she had to go see a foot specialist, and she was always worried about making her appointments because she didn't have paid sick days and she couldn't afford to miss out on work.
People don't know about. And so, when you call these healthcare members or workers heroes, they're more than just heroes. These are folks that are going through some deep struggles, that are committing themselves, because all the while, the whole conversation, half of it was about her family and the situation with COVID and not being able to see them. But the other half was, I want to go back to work. I want to go and service my clients. And that's the commitment that I think people don't understand these healthcare workers have to their profession. And so I just wanted to share that as a way for you to picture the struggles that are out there, the situations that are out there.
And the fact that I had a up and coming toddler that I needed to think about. So trying to figure out how I was going to accommodate that was a huge concern, because I was fortunate enough throughout the pandemic to not have a severe loss in my income or depletion in my income. So, but with childcare and putting her in a public daycare setting was a huge concern now in terms of risk of exposure to COVID. So as a result, we were able to kind of bring my mom in. So she's been living with me since the start of the pandemic last year. She moved in with me throughout the course.
I'm still making $2 less than minimum wage because the government assumes I'm making tips. But when those tips aren't rolling in, I'm losing more than people think. And I don't really know how to tell that to people, because I can't really tell it to the customer, hey, I really need you to tip me because the government assumes you are, so they won't give me more money. And I did get a pay raise by 5 cents. That does nothing for me. Not for the employer thing. I think the government increased the minimum wage for everybody. I used to make $12.40 now an hour. Now I make $12.45 an hour. So
minimum wage in Ontario is $14. There's lots of exceptions to that for students, for for example, gig workers, they don't really get a minimum wage. It's so bonkers for me to try to understand how poorly those workers are treated.
Or the Canada Revenue Sickness Benefit. So basically I was sent home for about a week because I was in close contact with one of my coworkers who did test positive. I had to take a test. I ended up testing negative, but I still had to stay home for a week. Basically missed out on a full week of pay. So my employer decided not to pay us for the sick leave, and instead we had to go through the CRSB. So I had to apply online. The basically paid out to receive $450 after tax, which is a little bit less than I would make. But regardless, I waited for 2 weeks after I applied. I didn't receive it, so it was very low in funds for those. Basically, rent was due and groceries. I had to buy those things and do those things, and I didn't have enough money. So I was basically going a little crazy, trying to figure out how I'm going to afford all these necessities. And so I didn't receive any indication that I did anything wrong, or if I was going to receive or not going to receive it, if I qualified or not. So I had to call the Canada Revenue Agency, and it was resolved after I talked to them, but there was no communication on their end. And I basically received it a month after I was supposed to. And so, I was very low on funds for those the whole time.
There's data from Peel Region that's, has shown that like 1 in 4 people who were sick with COVID and had symptoms went to work sick anyway. Why? Because they can't afford to, right? Or they fear that they're going to get reprisals from their employer. And this is particularly important for temp agency workers.
But it's the mental health stress and the mental health toll that this pandemic has taken on our frontline healthcare workers, but not just the frontline healthcare workers, their families. I've heard stories from members who had to isolate because they were exposed. And so they had to go to a hotel, or they had to go into a trailer and live in a trailer, isolated from their kids, isolated from their families. And so, you put that on top of going into work every day, knowing that you have an employer that has historically shielded and hoarded protection, and you have to constantly beg for the right protection, and that fear and that mental stress really impedes on your ability, or their ability, to do their job to the fullest and provide the highest quality of care. And then if you add another layer on top of that, when the government announced that healthcare workers were only able to work at one facility, there's a financial impact there on top of the mental health stress. And so for the last year or so, you've had a number of, we've had thousands of our members that worked multiple jobs. So some worked 2-3 jobs pre-pandemic, and now they're only able to work one job with no relief. So there's no government funding to subsidize to help them out through this time. And so you have that financial stress on top of the mental stress, on top of the work stress. I mean, it's just a real bad situation for them. And so, we had advocated from day one to increase the wages, provide paid sick days for workers. And I mean, we see sprinkles of that. The government recently announced some PSW extension for their wage enhancement, but that's only PSWs. What about everybody else, right? What about
the pay structure? A lot of feedback, and not just feedback, but a lot of conversations with many members of my team, as well as throughout the company and in a social construct, have mentioned, or it's even displayed everywhere else, it's just the differentiating pay levels and work required. I think frontline workers are, we now realize with the course of the pandemic, essential workers and who they are, what we need in order to run an economy and to keep people safe, protected, and provided for. So something as simple as a grocery store wouldn't have never been considered an essential service, but it is now. It is, and the priority is there. So for me personally, I think that these individuals that go out every day, who are constantly facing the onslaught of people that are coming to the store to mass purchase or do any of these things, or coming in panic and fear, should be compensated. Personal support workers, smaller groups or segments within the workforce do need to be compensated because of the fact that they are essential. This is important, and what they're doing should not go overlooked. Their work is vital in order for the survival of our economy and our society as a whole. So I think even just supporting something as simple as increasing in wages and minimum wage to make the cost of living. Studies have shown that the cost of groceries is going to increase by $600 a year, and people's raises aren't even that much. So how can they now afford to be able to provide food for themselves when these things are not being considered? So I think for me, I think that needs to change. And if we need to do anything, it's stepping up for the people that have fought so hard to help us stay safe and well fed and protected throughout this entire year.
And what they're risking when they go into work. As we've seen like recently with like the Amazon warehouse in Peel region that, you know, public health had to shut it down. Like those workers don't have anything like paid sick days. And yeah, like I said, it's a lot of pressure because that means that even if you are having symptoms, you don't have the option but to go to work, right? At like a rehabilitation center. And she was diagnosed with breast cancer. And she didn't have any paid sick days. She worked full time. And what happened is that she would like go get her like chemotherapy and go to work. Like she would go to work really, really sick because she didn't have any paid sick days and she couldn't afford to not work.
And the fact that Ford sees there's no reason for paid sick leave, I feel like that would have avoided this whole stress induced situation for me. Yeah, so it's just a very difficult time, but yeah, I did get through it, but I feel like it could have been avoided.
You know, if you give people the financial support they need in order to implement these things, then they're going to do it. I mean, doctors and nurses don't have the same benefits that I do in film. And that's just because of the fact that their budgets aren't the same. You know, we have a much greater interest in television shows apparently than we do in those other problems. You know, the government gives large tax benefits to film in order to allow us to occupy space in these cities and to create films. You know, there's the tax credit that pays a portion of my salary. If you look at the Ontario tax credit for film and television, but you have no such subsidies for doctors to the same extent. I mean, you know, they're obviously publicly paid for, but the proportion of those things is massively crooked.
You know, it's a different type of advocacy now. It's advocacy in the sense of like, you know, phone calling members. Like I have a weekly phone call list that I have a running list where I'm talking to members who are going through deep struggle through COVID. And then I'm just encouraging them because it's so tough out there for these healthcare workers that the easiest thing for them to do is give up and give in to the moment. And so it's my job and the job of our union staff and all the other elected officers to instill a sense of urgency, a sense of like, you know, push through what you're going through, because we still need to advocate. We still need to fight for change, and we still need to make our voices heard, even though we're in a pandemic. And I think there's a lot of like digital activism going on. Pandemic has really painted a very ugly picture of politics in my own personal view, because one, we elect and to trust that they're going to do the right thing by the workers and the members of society. And I think they failed on a number of fronts. I think they failed to recognize the deep commitment and sacrifice that these healthcare workers have made and continue to make, and haven't compensated them fully, haven't protected them fully, haven't held these employers to account when they've gone wrong and been negligent. And so overall, it's just, yeah. And the pointing the finger and saying it's the federal's responsibility, the federal government saying it's provincial responsibility. Like nobody wants to hear that stuff. You know, people want relief. They want solutions. And so that's been the frustrating part of this whole thing with the politics involved, where it's like everybody's pointing the finger at each other and like nothing gets done. Meanwhile, healthcare workers are still sacrificing. Seniors are still dying, you know? And so that's been the unfortunate part of it. You know, I mean, I don't know how better to explain it. I there's not words that I can use to describe what these healthcare workers are going through. And I'll share one story. And I was hesitant to share
because we don't have that job that's that offers us the luxury of staying home. So yeah, there's a lot to it, and we should actually really be out there advocating for better labor laws, for better workers' rights. Like that's why I'm out there on the front line advocating for paid sick days, because it goes beyond me. It goes to the other essential workers who are probably in a more precarious situation than I am. Like I'm lucky enough that I have a union. Like if, for example, something goes wrong, that the union could be like, hey, you guys got to pay him for this day. But there are a lot of workers out there who doesn't have that. So
question the things that they say and get to know the real truth about it. And that is what I would like Canadians to know, to challenge the things that they hear. Challenge it, question it, challenge it. In politics, what do we hear? Oh, I am for the poor man. But when they get into office, what do they hear? A different song. In politics, we hear, oh, that's a real change. When they get into office, what do we hear? The new reality. And what's the new reality? Short-term employment. And that is another thing I would like people to know. That the federal government in office, the previous election, they got into office on a platform of real change. And that's what people were expecting. Now they're saying the new reality is short-term employment. And where did they get that? We are temporary workers. We are seasonal workers. And we've been seasonal for so long. So they've tried it on us, and now they've been into mainstream employment. So our issues are related to workers' issues in Canada. So we are not disconnected. Yes, we are connected by food, but we are also connected by way of employment standards. So our issues are related to your issues. So we are all connected, and do not think that these are guys fighting in isolation. No. An injury to one is an injury to all. An injustice to one is an injustice to all.
The justice focus, the advocates amongst us, start to build movements, start using our voice to shake the ground. That was one of my quotes from another interview that I did. Whether it's gender issues, environmental issues, homelessness and housing, we need to build those movements so that the paid sick days is on everybody's lips moving forward. That Indigenous rights are something that everybody stands up for and demands. That access to affordable housing is something that everybody fights for, and that type of thing.
I think sometimes we can get really bogged down in like, what does a win look like, right? And sometimes, like for some types of advocacy and organizing, that can mean like a legislative win, which means that things are changed into law, which is definitely one form of winning, but is also something that's like really rare. And so I would encourage people to like reframe a win as like changing the social discourse, or like even changing one person's mind, right? Because that's how change actually happens.